Welcome to another episode of the Late Late Aesthetics Show. Today I'm joined by the fantastic surgeon Nora Nugent. Thank you so much for joining me today, and it's a pleasure to have you on the Late Late Aesthetics Show.
Thank you so much, Vanessa, for inviting me. It's a pleasure to be here.
And I can't wait to delve into the whole surgical landscape in more detail. You have a wealth of knowledge. You've been practicing for several years now. So tell me a little bit about your experience. How did you venture into the surgical realm to begin with? And why cosmetic surgery?
Well, it started off just being a medical student in Ireland.
Yeah.
And then I went into surgical training. I always felt more of an affinity for surgery compared to the medical side, and I liked doing procedures. And as part of my early training, I had a plastic surgery rotation, and what really drew me to plastic surgery was the variety and the visual aspect.
Yes.
And it is life-saving surgery in some aspects, for example, in burns or head and neck surgery or situations like that. But in every other aspect, there is a huge quality of life improvement. Mm-hmm. And it was the variety and the planning and visual aspect that drew me to plastic surgery.
And you, do you still work within the NHS, or do you only work privately at the moment?
Not anymore. I worked in the NHS for 10 years and I left to go into full-time private practice in 2022. Fantastic. So now it's gone from a mixture of reconstructive and aesthetic work to almost entirely aesthetic work these days.
Oh, brilliant. And what is your specialty? For the viewers, where is your main specialty and where's your main passion?
So face and breast surgery are my two main areas of interest. Okay. I would say I like them equally. So,
yes.
I still do body contouring, and because a lot of my patients want combination surgery, breast and body surgery. Yeah. I do a lot of labiaplasty because a lot of patients want a female surgeon for labiaplasty surgery. Yeah. But my passion is in facial aesthetic surgery and breast aesthetic surgery.
So when you say facial aesthetic surgery, you basically mean in facelifts,
facelifts, eyelid lifts, upper and lower eyelids, brow lifts, rhinoplasty. There are other procedures, but those will be the main ones.
And when it comes to facelifts, because obviously the whole non-surgical landscape has developed dramatically, definitely over the last 5 to 10 years, there's a lot of things that we can achieve through a non-invasive approach, but there are a lot of times where a surgical solution is the only solution available. Have you seen a decline in facelifts over the years, or are they still as popular and, regularly carried out?
We temporarily saw a decline in facelift surgery, partly due to the rise in non-surgical treatments available and the improvement of non-surgical treatments as well. They can now do more than they used to be able to do in the past. But actually, in the last couple of years, there's been a rise again, and I think there are a couple of reasons behind it. Yeah. Firstly, at some stage, a lot of people come to the limit of what non-surgical treatments can achieve. And to get more or to maintain a natural result, the next step is surgery. Yeah. A facelift is still the best way to lift a face. Yeah. But it's not mutually exclusive. There are complementary non-surgical techniques alongside surgery. Okay. Another reason, actually much more recently, is the rise in the use of weight loss medications. Yes. Because when you lose a lot of weight, often volume is lost from the face, and although you obviously get aging changes as well, you get a sort of an accelerated effect because of weight loss if you previously had a very full face. Yeah. So I'm seeing a rise in patients because of weight loss medications. And then finally, greater awareness of these procedures in general. Definitely. And there are younger, I'm not saying we're doing facelifts on patients in their 20s, but we are seeing younger patients coming forward looking for facelifts as a longer term solution rather than multiple more temporary solutions to stave off changes.
When it comes to facelifts, I think quite often people find them extremely daunting. They think it's going to be really painful. They're going to have to wear bandages for months on end. What is the typical process behind a facelift?
So I think the very first thing people are afraid of is looking like they've had a facelift done. Because everyone has this image in their head of some awful photograph they saw online of a celebrity with a facelift that looks like they've had a facelift or way overdone. And modern facelifts do not do that whatsoever. Okay. Obviously, there's a recovery period. Yeah. So the first thing is understanding what it can do for you and getting the timing right so you can recover properly. Yeah. The first couple of weeks, they are usually reasonably swollen. It does look a little bit overdone because of the swelling in the early stages, but by 4 to 6 weeks, most patients are what we would say socially acceptable, as in if there's an event to go to, then they're ready to go.
Absolutely.
But I generally say about 6 weeks for lifestyle restrictions of some sort, about 6 months for most shape aspects and swelling aspects, and about a year for scars and the final finishing changes.
Okay, great. And there's obviously follow-ups that need to take place post-surgical procedure as well, which is, important to go see a trusted surgeon who understands that the follow-up is as equally as important as the procedure itself. It's not just that you come for your procedure and the surgeon's never going to see you again. I think that's not the best way to obviously carry out a procedure. But I think when you've got that continuity of care, you can monitor the patient as well, which is great.
Absolutely. And we have a sort of a regular schedule of follow-ups for every procedure, because we know what typically is needed between sutures out, wound checks, checking on progress and scars and so on. But obviously you have to be accessible in between those appointments should a concern arise, and not everyone absolutely fits the usual schedule.
Exactly.
So it's about being able to modify the plan when needed and being available to.
So what is the typical age limit of somebody who's considering a surgical facelift that you're seeing in your practice?
So for the majority of patients, I would still say the average age is 50s and 60s, but we are seeing younger patients coming, and really at a younger age, it's down to, have you enough physical changes that justify the surgery? And whether that's aging changes or volume loss from weight loss, or in some cases, we actually see quite young patients for neck lift surgery where their anatomy predisposes them to having double chins or very full under chin areas. And it's down in that particular group, which are different to the aging group. It's down to having a small jaw and chin, and effectively the structures that normally are tucked up underneath don't have enough room. So you get this double chin effect.
Okay.
And the main ways to counteract that are deep neck surgery, where you reduce the content, the tissue bulk. Sometimes chin implants, and that's probably our youngest group, because those patients can actually be in their 20s, which sounds extreme for a neck lift, but it's not for aging purposes. It's for, I would say, contouring purposes.
Okay.
Then the next group that are still young are either for some contouring purposes or early signs of aging, or accelerated appearances of aging due to weight loss or some other, or maybe some sort of connective tissue disorders can make skin sag or stretch more quickly. So that's the next youngest group.
Okay. And things to keep in mind when considering a facelift. What about individuals that have, let's say, had filler injections in the past? Are they still suitable for a non-surgical, for a surgical facelift?
Generally speaking, yes, but the fillers can have an impact. It very much depends on how their tissue has reacted to the filler and how much filler is there. If someone very obviously has a lot of filler in their face, I would want it dissolved ahead of surgery. If they've had filler, but they don't necessarily look overfilled, I don't insist on dissolving before surgery. I'll deal with it at the time of surgery. And by and large, I would remove what I come across at surgery, partly so I can judge the facelift properly, and partly because I've now exposed the filler. So from a contamination or infection point of view, I would want to remove it. Some filler can leave scarring, and especially the biostimulatory fillers, they are the combination fillers. They can leave scar tissue in the deeper layers. It doesn't stop someone from having a facelift, but it can affect the level of difficulty or the technical ease in which a facelift is done.
Totally. What about if somebody, let's say, because the younger generation, definitely I would say maybe 18 to 25, years ago, there's a big focus on fillers, and they obviously all injected fillers. So what about those individuals when they get to their 50s and 60s and they're considering having a facelift? What would happen? Would they still be suitable for the procedure? Would there still be filler present, or does it just vary?
It varies a lot. I think the general principle to go by is it's not that filler is bad, it's overdone filler is bad. And be aware that even temporary non-surgical treatments can leave a lasting effect, particularly if they're repeated multiple times over many years. So everything in moderation. By and large, we can still do the facelift, but we may see the effects of the previous treatments in the fillers. And if someone has been significantly overfilled for a long period of time, for example, cheeks or lips, when you take away that filler, it has stretched the skin, so it does leave a lasting effect. So it's not a benign procedure to be done lightly. It's an easy solution at the time, but it does have a consequence. And I'm really not saying all fillers are bad. Fillers have a good place and can give really nice results. But the key is subtle results and knowing when you reach the limit of what a filler can do.
Absolutely. What is your philosophy when it comes to patients that come to you seeking cosmetic procedures?
I think the first thing is allow enough time beforehand to really understand what someone wants and why they want it. And then it's checking, can I actually achieve that? So it's marrying up what I see when I physically examine someone versus what they want to achieve from the surgery. And the two have to fit, otherwise it's not going to work.
Absolutely.
So it's really fitting expectations to what I can do and spending enough time to tease that out.
Fantastic. Do you find that people sometimes misunderstand what surgery can and can't do?
Very much so. So my start point is generally that someone who comes to see me doesn't know about the procedure, so I start from scratch. And I obviously have some patients who may have had surgery before or who've done a lot of research or had previous consults, but my start point is that they don't know about it.
Yes, and that's why they're going to see you at the end of the day.
Exactly. And there are several misconceptions with plastic surgery. One very common misconception is scarring, that plastic surgery doesn't leave scars, and it does leave scars, but we try to leave as good a scar and as discreet a scar as possible, so it's not noticeable afterwards. But we very often have to explain that yes, there will be a scar. And I normally show examples of scars. I show them where the scar will be on them and the extent of the scar. So that's one very important aspect. And then the next thing is what's actually achievable for them as an individual. I get shown a lot of photographs of what they would like to look like. I hear a lot of, and I have to hear about their aspirations for surgery. It's really important.
Of course, yeah, definitely.
But then I have to be very honest about whether I can achieve that, because not everything is possible. It's down to anatomy and what I can do and healing.
What do you do in a situation, let's say if you've got a female in their 60s and they have, let's say, lots of lax skin? Is there a solution for that? Is there anything you can do? I'm thinking from a non-invasive point of view, there's very few things that you'll be able to do in that situation to give that person that tight lift that they want. If the skin is completely lax, what options are available?
So quite honestly, the best option in someone who has really extensive skin laxity and maybe a lot of sun damage, the best option is to have a surgical facelift and non-surgical skin resurfacing or rejuvenation. So use the two to complement each other.
Yes.
The facelift to lift and reposition and essentially do the hard work in terms of skin laxity, but the non-surgical, for example, facial peels, long-term medical grade skincare, laser resurfacing to improve the quality and the texture of the skin itself.
Yeah, definitely.
So that would be my advice in those really tricky situations, is actually to use both surgery and non-surgical techniques to complement each other.
Absolutely. I think, that's like your maintenance afterwards.
View skincare as maintenance for whatever I do.
Yeah.
The better your skin is, the better things look and the better they last.
Exactly, you're quite right. I think there's a lot of emotional aspects when it comes to surgery. And I think when you go under the knife, so to speak, you have to really, really understand the reasons why you're going through that. Do you think that there's a lot of mental aspects involved, and how do you really assess that when preparing a patient for a surgical procedure?
So it starts before I even see someone. I send out a health questionnaire in advance of my consultation, and it's a small screening and questionnaire within it about how much the concern affects them, how long do they spend thinking about it, does it stop them from social interactions or so on. So it starts before I've even seen the patient. And then at the very beginning of the consult, the very first thing I do is ask someone why they're here, what's driving the need for surgery, and then I ask what they want to get from it as well, and then we go from there. And it can be really complex, or it can be very simple, and everything in between. But it's really important to delve into that beforehand.
I agree. Have you ever had to say no to a patient that's maybe come for a consultation? Have you ever had to turn a patient away?
Yes, and obviously the start point is the patient has come to me for a solution to the concern, and my start point is, how can I help? What can I do? But things have to be done at the right time and for the right reasons. So sometimes ultimately I will do the procedure, but they're not quite ready yet. Either they're not prepared enough for the recovery, life is too busy, they haven't factored in, it's a far more complicated procedure than they'd anticipated, with more downtime than anticipated, and life is just too busy. Young children maybe not able to take time off work or any other reason. Sometimes it's just not the right time in terms of too close to pregnancies or breastfeeding. I do a lot of breast surgery. Breasts have to be at a steady state, or maybe weight isn't, our health isn't quite right. And maybe we'll get there in the future. Sometimes we won't. If there are serious health concerns, sometimes that does draw a halt. And then it's down to the psychological aspect, being able to understand and weigh up the procedure, and actually having the procedure having a realistic chance of achieving the goal. And if it can't, you're far better off being disappointed for being turned down for surgery than being disappointed after having had surgery. It's a difficult conversation, but it's better to have that conversation ahead of actually investing in surgery.
I agree. So you mentioned before about weight loss medications, so like GLP-1s, for example, and there's been a lot of news articles out recently to show that when obviously people have lost a dramatic amount of weight in a short space of time, their skin laxity goes, whether that's on the arms, the face, the abdomen. Have you noticed that there has been a massive increase, let's say tummy tucks, for example? Are you having to do more of them? Is that an issue that's being presented more because the skin is just so lax and it's not actually fat, it's just skin?
Yes, in the last, I would say probably 2 years, I've seen a huge increase in patients who are either on or have been on weight loss medications. And actually, I'm seeing it for procedures across the body, whole body, face, breast, and tummy, because it has a sort of a uniform effect.
Everywhere, exactly.
Not everyone is bothered by the effects in every part, but it affects all areas.
Definitely.
So yes, a huge number of my patients are coming now having either been on weight loss medications or still on weight loss medications. And it's getting the timing right then as well, you know, in terms of being at their goal weight and at a steady weight. You don't want to regain the weight after having had the surgery.
This is it, exactly. And there is a difference. I think sometimes people get confused with liposuction and a tummy tuck. They're two different things from my understanding. How are they different?
So liposuction is reducing the fat between the skin and the underlying muscle layers for the most part. And it's not a weight loss procedure in its own right. It's more for reshaping stubborn areas, and it does not help loose skin. In fact, it can make loose skin worse. So it's for someone who has stubborn areas of fat that just don't go with diet and exercise, who's at a steady weight and who doesn't really have any loose skin or overhanging skin. Then liposuction can be a very good option in that situation. And you're going to use tummy as an example because I see a lot of women after pregnancy. You know, so you get the stretch effect of the pregnancy and things don't quite go back to how they were. And quite often you have lax skin on the front of the tummy and an overhang of skin. And liposuction will only make that worse. It's useful with a tummy tuck, but not instead of a tummy tuck in that situation. It's an abdominoplasty or a tummy tuck to repair the muscle separation, tighten the loose skin, and then if you want liposuction, to use it to fine-tune contouring around the waist afterwards. You can do it at the same sitting, but after tightening the skin.
Even for men, so I'm finding that men, well, you obviously know a lot better than me, but I'm finding more men are coming forward and they're having more surgical procedures for the abdomen to give them more of, let's say, a ripped look, and to give them more of a more chiseled definition, or if there's any loose skin there. Does that procedure also work really well for men?
Yes, it does. And apply. Obviously, they don't have the pregnancy-related changes, but the same principles apply about being at a steady weight, being at a good place in terms of life and lifestyle to have it done. But then it can work really well. And while I don't do high-definition body contouring myself, there have been huge advances in that field in the last decade as well.
Massive,
in terms of getting more sculpted appearances and in really pushing the limits of body contouring, like abdominoplasty, liposuction, even fat grafting to build up some muscle groups.
Absolutely. No, it's fascinating the way the industry's moved, and it's like anything.
Keeps moving.
It does, and I think because science has just developed so much. You know, when you're doing procedures, you're learning new techniques. New things are constantly evolving, which is great. So we'll go through a few myths that I think are associated with plastic surgery. We've kind of touched upon this, but if you just give me like your clearest answer possible. All breast implants need replacing every 10 years.
False. Need to be checked every 10 years and in between, but if there's no problem, they don't need to be replaced.
And was there not a case a few years ago where there was a lot of implants that had to be removed?
Yes.
What was the reason behind that?
These were PIP implants, which was discovered, obviously, unfortunately, after many had been placed, that they were more likely to rupture or leak compared to every other implant.
Okay.
And this was mainly because the manufacturers did not adhere to the right standards and did not use medical grade silicone. They used
a cheaper alternative.
It's still silicone, but not medical grade.
Okay.
So those implants were 6 times more likely to rupture.
Wow.
And they were withdrawn from the market, and obviously a lot of women had them replaced.
So is it important the type of implant that's used? That's crucial.
Yes. So the criteria I use when picking an implant is one, have they passed the necessary standards? So in the EU, it's a CE mark, and still to some degree in the UK. The UK will have its own CA mark very shortly. Some things are coming on stream, or FDA. It's the equivalent of FDA approval. So they have to, at a minimum, have passed that. And in reality, most hospitals won't let you use implants that have not passed those standards.
Of course,
Ideally, then, I want to use an implant that has a good track record, so at least 10 years of data, a good track record in terms of rupture, in terms of capsular contracture, which is the build-up of scar tissue, in terms of holding its position, not dropping out of place.
Of course.
So those are the first criteria. And then it's how it looks, how it feels, how versatile the range is to fit individual breasts, and what the shape and size ranges are.
So it's literally not one size fits all, basically. You have to really tailor it to the patient.
Tailor it to the patient.
Okay.
And they do need to be changed in the future, but not just because they're 10 years old, when a problem occurs, rather than automatically at 10 years.
Okay, so as long as no problems occur, leave them. They're fine for life.
Have them checked, leave them alone.
Yeah. During a consultation, have you come across any myths? For example, a patient presents a certain thing that they've maybe read online, for example, and you know it's not true. Is there anything that springs to mind that you've heard maybe recently or, over the years during a consultation?
So we do get asked sometimes, for example, as we said at the beginning of our conversation, my practice is focused more towards face and breast. And for facial patients, I often get asked about facial exercises and things like that to tone up facial muscles and neck muscles. But sadly, the reality is that doesn't really change aging.
Yeah.
So that is one thing that I have to dispel.
Quite often.
Yeah, it won't do the trick.
Yeah, exactly. I think a lot of people as well, they get hooked on this whole toxin trend. For example, they get really in the routine of having to do toxin every 3 months because they think if they stop doing it, their face is going to all of a sudden collapse and wrinkles are going to form.
They won't.
It's going to be loose, and that's not the case, right?
That's not the case. You will obviously lose the effect of the toxin, but you won't be You won't be worse than before having the toxin in.
Yeah.
What I would say, one myth about toxin is preventative toxin. Just be very careful about preventative toxin. There's very little value when you have absolutely no lines in your early 20s in having preventative toxin. It will have worn off before it can prevent anything because you would not have developed lines at that point anyway. It's different if someone has more lines than expected and there's actually something to treat. But I would say to people hearing about preventative Botox, be very wary.
There must be a lot of red flags, I think, when considering surgery because, you'll hear about travel tourism, you'll hear about patients going abroad for surgeries, the aftercare is not followed, they come back with complications. Are there any red flags that you would say to a patient considering cosmetic surgery that they should look out for?
Yes. So I'm going to talk about UK first and then maybe overseas. First thing is make sure your plastic surgeon actually is a plastic surgeon. The term cosmetic surgeon is used very widely and does not automatically mean plastic surgeon. So the first thing is to make sure that the surgeon is actually a plastic surgeon. Obviously, if you're having your nose done, an ENT surgeon would also be fine. But or having your eyelids done, an ophthalmic surgeon would be fine. Yeah. But in general, make sure your cosmetic surgeon is actually a plastic surgeon. The terms are not necessarily the same.
I know. I've actually found that there's a few surgeons, for example. I use that very lightly, that, for example, are trained in procedures like face tight, body tight, and they're not actually a plastic surgeon, but they're still carrying out those. And
those are quite invasive procedures
yes.
to have. So my recommendation for cosmetic surgery procedures is go to a plastic surgeon.
Yeah.
And check that they are a plastic surgeon.
Absolutely. Do you believe that some surgeons are saying yes too easily in today's marketplace?
I think, generally speaking, there probably are a group who are saying yes too easily or to too many procedures, or maybe not being selective enough in who they offer surgery to. We talked earlier about suitability for surgery. there is overall an increase in demand for aesthetic or cosmetic surgery. So the numbers are overall going up, but a conscientious surgeon will reserve their judgment for each individual case rather than just signing everybody up.
Yeah.
And again, it comes back to what happens beforehand and making sure you actually meet the surgeon who is a plastic surgeon and who will be doing your surgery, not a sales rep. So you have to actually meet the surgeon before doing the surgery.
They're the ones that are going to be operating on you. I mean, look, I've heard horror stories, for example, people that I know who have been to Turkey, for example, for surgery, and maybe they've gone in for a breast lift or, you know, breast enlargement or something, and then they've taken fat from other areas of the body while they're there. They'll do a bit of liposuction. It never should be like a pick and mix. And
the problem with that, there are world-class surgeons in Turkey, and some of the best surgeons in the world in some specialties are in Turkey. But the problem with travelling overseas is it's harder to know who you're getting. It's much more difficult to meet them beforehand. By the time you get to Turkey, you've effectively signed up and committed already. You know, the train has left the station. I know. And so you're going to go ahead, and then if you have a problem, there may be a language barrier. And if you have a problem afterwards, either you're in the country overseas for longer than anticipated, or you're left a little bit high and dry when you're home and you can't get back to the surgeon. Yeah. The follow-up is an issue.
Exactly. And for example, it's surgeries are advertised online on social media as in like body shapes. It's like you can book in to be this body shape, which is just a crazy concept. Yeah. But I think that has really misjudged the way people view themselves as well. Yeah. Do you think that that's made it more difficult? Because are you finding patients coming in saying, with a picture saying, make me look exactly like this? And how do you handle that situation?
So online images have transformed aesthetic surgery and non-surgical procedures because of the availability, the use of filters, the clever use of lighting and makeup and contouring and so on. And, you know, it in some situations, it's built up totally unrealistic expectations about what can be done.
Definitely.
The person they're looking at doesn't even look like that. You know, it's filtered and contoured and airbrushed and so on.
Yeah, and it's just not realistic.
It's not realistic.
No one looks like that on a daily basis whatsoever. If you could say one thing to every patient considering treatment, what would it be?
Really think about why you want it and what it's going to do for you beforehand. Yeah. Okay. It's really important to understand why you're actually having something done.
You're right. And where can our listeners find out more about your work and maybe contact you?
So I'm based in Tunbridge Wells at Purity Bridge Clinic in Tunbridge Wells. My website is noranugent.co.uk. I'm also on Instagram, and from September I'll be once a month on Harley Street as well.
Oh, fantastic.
So it's Tunbridge Wells and Harley Street.
Great. Thank you so much. I think we could talk all day, but maybe we have to do a part 2 for that because there's so much to debunk and dispel about the surgical space. But Nora, you've been a fantastic guest. Thank you so much.
Thank you so much for inviting me.
Thank you.